Hi Dr. Sandeep, my relative underwent biopsy. Can biopsy leads to spread of breast cancer?
It's a very interesting and very important question because there are many patients or many people who come to me and ask me this question. There has been over the years a rumor or a malinformation which has been spread that biopsy of suspected cancer spreads the disease. But the fact is, in most of the times it does not. It is very safe. What is biopsy? Biopsy is removal of a small tissue to examine it under a microscope to confirm what type of tumor it is. It could be benign, it could be cancer, it could be anything. So to confirm, we need to look at it under the microscope because whatever I feel is cancer may not be actually cancer. So that is the only way to confirm. So it also helps in further treatment of the disease, as I have already discussed in my previous videos. Now, there has been a consistent effort by some people, some quack who are not qualified in the particular field to spread this kind of rumors across the world. It is nothing new, it is nothing really to do with a particular geography or particular population. It is there across the world. So what has happened over the years is, people have studied the data because, we as scientific people need to really see, is it really true? So people have studied data. There has been many research papers studying multiple, huge number of patients to see whether it is true. Does this question exist? And the result was very interesting. They found out that there can be a needle track deposit of the cancer tumor. Wherever we have passed the needle, that track, there can be a deposit of cancer tissue in less than 1% of the patients. It's interesting, in most of the cases, we remove the needle track also when we do surgery. So, which means we are not talking about a spread of the disease in rest of the body. We are talking about only the needle track where there can be deposit because the tumor tissue needle was passed into it. If at all, that is what can happen. So, as you remove the needle track in most of the cases, so the risk of cancer spreading just because we did a biopsy is near to nil. So, this is the fact, and the other one is a pure myth which does not have any scientific grounds. So, it can be completely ignored. So, biopsy of a suspected cancer tissue is very important and has to be done in most of the situations. Having said that, this talk what I am doing is mainly for breast cancer. There are exceptions where we say a biopsy is not indicated. That is in cancers of the kidney, suspected cancer of ovary, and there are some other few situations which your doctor will be able to tell you that cancer biopsy is not indicated. But barring this, all other cancers, including breast cancer which we are talking about today, we can safely do biopsy. Thank you.